Hello, I'm Tracy Shulsinger, family nurse practitioner, and I'm here with Dr. Joseph Cohen. And we are here to talk about functional medicine and cannabis medicine regarding pain disorders, addiction, and neurodegeneration. So we have some startling statistics to share with you. According to the National Institute of Health, Drug Abuse and Addiction, in 2014, there were approximately 20,000 deaths from opiate overdoses and approximately 8,000 deaths from benzodiazepine overdoses. Dr. Cohen, how can cannabis medicine help to relieve this problem?
Well, cannabis can be used in several ways to relieve this problem. Number one, it actually replaces the need for opioids or narcotics because it is a very good pain reliever as well as an anti-inflammatory. It also reduces the need for benzodiazepines, your Valium type drugs, because they're used for sleep and for spasm, two conditions which are very common when you have a lot of pain issues associated with it. So it works in both of those ways, in addition to the fact that it actually protects our brain. It actually can literally prevent something from happening in our brain called glutamate excitotoxicity, which is what we see in all neurodegenerative diseases, as well as in people who are weaning off of benzodiazepines, narcotics, and alcohol.
So if someone were to use cannabis to treat pain or treat muscle spasms or anxiety, isn't that just another drug? Is that a drug that also could be abused or could become addicted to?
So first of all, cannabis will not kill you. These other drugs can. So it's a very safe drug because it's basically non-toxic. You can't overdose on cannabis like you can with these other medications. Secondly, I very rarely see patients who are actually addicted to cannabis. It's a very low potential for addiction as long as it's used appropriately.
So you've mentioned the neuroprotective benefits of cannabis. Can you go into that more now?
You have neurodegenerative diseases such as Alzheimer's and senile dementia, as an example. When we talk about patients with Parkinson's and MS, we're talking about neurodegenerative diseases that actually produce glutamate in hyper amounts in the brain, and they kill brain cells. Cannabis prevents glutamate excitotoxicity and therefore protects our brain.
So for people who are wanting relief from, let's say, an acute injury, how would somebody who just had a stroke or who just had a concussion use cannabis?
They've done some preliminary studies to show that if you can get cannabinoids into your system immediately after the injury, then you are more likely to prevent the long-term side effects. Inhalation is the best method, and I would certainly recommend, if you're going to be inhaling, that you use the packs to inhale as quickly as possible. And you may want to use a high CBD strain as well, because that has neuroprotective benefits in addition to THC. Another method that I would recommend that you consider, this is a CBD hemp oil. This is mostly CBD with almost no THC in it. And if you were to put a couple of pumps of this under the tongue, because it's in a specific delivery system, you're actually going to get almost as quick of a delivery as you would with inhalation method. Okay. And the great part about something like this is that an NFL player, as an example, and I have spoken to NFL ex-quarterbacks and other players, and it would be wonderful to have something that's actually legal to use because it's made from hemp. You could have it in your locker, and if you have a potential head injury and you're concerned about it, just put a couple of pumps under the tongue as soon as possible.
Thank you for that explanation of how we can really protect the brain after an acute injury. And what about people who have chronic degenerative diseases?
We're going to protect it very similarly, only we're going to be using this on a regular long-term basis. All neurodegenerative diseases, whether it be senile dementia and Alzheimer's, whether it be MS or Parkinson's and several other neurodegenerative diseases, have one thing in common. What they have in common is the fact that they kill brain cells. So cannabis prevents that from happening. There's a variety of different methods that you can use when you're treating these conditions. You can pick and choose any method that works for you, but I do recommend that you go with higher CBD strains. Inhalation, again, through our packs is a great way to go when you're looking for a rescue dose. So cannabis, when used for, say, dementia and Alzheimer's, they're finding all kinds of potential benefit. There was a recent study that actually said that you're actually reducing amyloid plaque. That's what happens in the brain when you're developing Alzheimer's. You get this plaque formation, and cannabis actually may reduce that amyloid plaque from forming. There are many other things that will contribute to dementia and Alzheimer's. Obviously, there's a genetic predisposition, but in addition to that, many people who do not have genetic predisposition also develop Alzheimer's because of the way they live their life. Foods are critical for this. Mark Hyman, in the blood sugar solution, coined the phrase type 3 diabetes as a major contributor to senile dementia and Alzheimer's. So by lowering the glycemic index of your foods, meaning eating foods that do not turn into sugar, that raise your insulin level, that cause inflammation, when you eliminate those foods or limit those foods, you're far less likely to develop dementia and Alzheimer's. So there are exercise, there's many other things that we can do to help prevent this from happening.
So cannabis is one tool amongst many important tools to prevent neurodegeneration.
Exactly.
And taking a holistic approach, I'd imagine, is going to be the most effective way to save your brain cells and to live a long, intelligent life. So this is a really empowering message. People can do plenty natural and lifestyle treatments in addition to using cannabis to treat pain disorders, addiction, and neurodegeneration.
Exactly.
Yeah. This message is important, knowing that there's a holistic approach to really empowering yourself to take control of your own health, help your family, and help your friends. And so thank you, Dr. Cohen, for empowering our audience in this way.